I'm Steve Adubato. It's my pleasure to introduce two of the most significant medical leaders in our state and our nation. Dr. Andre Gua is chairman and director of the John Theurer Cancer Center at Hackensack University Medical Center, and his colleague, Dr. Andrew Pecora, vice president of cancer services at the John Theurer Cancer Center at Hackensack University Medical Center. Gentlemen, thank you so much for joining us. Andre, back in December of 2015, the 25th anniversary of the center, correct?
Correct.
How would you describe it?
So this was a nice gathering of physicians, patients, and key opinion leaders of the region who came to celebrate together around Sudhata Mukherjee, who won the Pulitzer Prize for the biography of cancer. So that was sort of a summary of our biography of cancer over the last 25 years, where we have been very implicated firsthand in some of the important milestones in cancer discovery. And this was also our completion of 6,000 bone marrow transplants in our program.
Back up, 6,000 transplants? 6,000
transplants since the inception of the program 25 years ago, correct.
And how many clinical trials?
We have over 300 clinical trials open for enrollment as we speak.
And what kind of areas?
This is a lot of novel therapy discovery, cell therapy, immuno-oncology. You know, when you look at cancer, cancer is changing we are likely at a turning point in oncology.
A turning point?
A turning point in oncology.
Why is that?
When you think of cancer cells are the results of the accumulation of genetic mistakes that we call mutations. So enough mutation drive a cell into a cancer cell. That's what drives them. Cancer cells also have the ability to hide from the immune system. The progress in understanding this provides an opportunity for two things. Novel therapy that can target some of these mutations and block some of these mechanisms, and that's what's going to replace chemotherapy in some situations. The other thing is that we can harness the immune system to try to wake up the immune system and recognize again cancer cell. And both the combination of this thing is reshaping the way we treat cancer.
Dr. Pecora, you've been at this with your colleague for a while, and we've talked offline together about these issues. So many people, after all the research, after all the media coverage, which sometimes doesn't help, sometimes does, sometimes is confusing. For many, when they hear the word cancer, it hasn't changed. The stigma, the fear, how paralyzed people are. How much of that is warranted, how much isn't, and loaded question, how much of it has to do with which cancer we're talking about and at what stage?
Well, I think you summarized it in your question. You know, the biggest issue is lack of knowledge. That's what drives fear. You're afraid because you don't know. You know that it's a problem, but you don't know exactly what it means to have what you have. You don't know where you should go to get treatment. You don't know how it's going to affect you and your family. We at the John Theurer Cancer Center, I think we've really addressed that. I mean, Andre alluded to it. You know, by having over 300 clinical trials, by being one of the most experienced programs in the world in a field like bone marrow transplant, that alone gives people comfort when they come to us. We're going to a place that these people know what they're doing. And then we go one step further, and that is we spend a lot of time making sure our patients understand exactly what they have. You know, what I like to say is, you know, Andre and I have been doing this now for over 30 years. It's like trying to fix a broken car with your eyes closed. That's how it was 30 years ago. You kind of knew where it was and you did it listening. Now we get to see, we're looking within the cell. We can see what's gone wrong with the DNA. We know how to target the immune system in ways that we can only dream about before. And it really is a transformational moment in oncology. 15, 20 years from now, very few people will be dying of cancer.
15 or 20 years from now,
yes,
regardless of the particular cancer, doctor, very few will be dying. You
yes.
concur?
Totally. That's
Make
why
the
I
case.
mentioned. That's why we mentioned we are at a turning point. I think we have two-thirds of the pipeline of medicine is in oncology. It is estimated to be around 9,000 compounds in the field of the pipeline of oncology. So all these novel therapy will help us target therapy, develop combination of targeted therapy that will be appropriate, customized to a given patient. And again, one patient, to replace chemotherapy in some situation, will give this combination of novel therapy, bring the tumor down, and then harness the immune system to prevent the relapse.
So hold on, Andre, is that molecular profiling?
Exactly.
What is that?
It's what we call precision medicine. Precision medicine is the term trying to customize the treatment based on the features of the tumor. So patients have a cancer that we diagnose, as Andrew mentioned. Patients are scared, but we make the diagnosis under the microscope. That was the old way to do things. Now we can dive further and try to understand how the cells are wired. And how the cells are wired helps us define treatment that will be customized to a given patient. That's what's called precision medicine. And the whole move of medicine as we speak, including in cancer, and probably first in oncology, is going to be to customize our therapies by combining the appropriate treatment for a given patient. So to use the Achilles tendon of the cell, if you want to call it, bring the tumors down, and then in order to prevent recurrence, harness the immune system that is really good at eliminating the leftover of the tumor cells and prevent recurrence. That's where the field is going.
But following up on Dr. Gua's point, Dr. Pecora, does this make future cancer care more expensive because it's so precise and, in fact, as Dr. Gua says, potentially much more effective?
When we talk about the expense of cancer care, this is a subject I'm now speaking on nationally and trying to help our government think about it as well. I've been invited to do that.
Why the government?
Because CMS is one of the biggest payers for cancer.
CMS, the folks at Medicare.
At Medicare, right. So right now the focus is on the actual cost of care, and that may be misplaced because when you look at the total cost of care, if you have to spend a little bit more money to fix a problem that otherwise wasn't fixed before, and it's going to cost the system a whole lot more money over time, that's where the emphasis needs to be. So even though we have these new medications, these new techniques that on a unit basis cost a little more money, what they're doing is profoundly changing the natural history of the disease. So people get back to their lives. They are not sick in the hospital. They're not being admitted to emergency rooms. So now that we're focusing on the effect on total cost of care, there's actually real value being brought to the system.
So cost has to be looked at differently.
Correct.
Real quick, what's CODA?
CODA stands for Clinical Outcome Tracking and Analysis. It's a data analytic company that we created out of Hackensack, and now it's its own company, that takes precision medicine and big data to find value. And the way it does it is kind of like a GPS device. It allows you to characterize an individual, everything about them, the disease they have, the intent of the therapy, and then it looks at where they're getting their care and what type of care, and it compares. If you got care A versus B versus C, where'd you have the best clinical outcome? Where'd you save the most amount of money?
Very important. Dr. Gua, help us on this. Last subject I want to bring up, the Life and Liberty event, which I've seen, and it's extraordinary. We're going to show some video of it. It's happening on October the 8th, 2016. It happens every year. Talk about it and where.
So that will be our 8th event. So we started this 8 years ago. After I treated a patient from the Statue of Liberty, who was curated at the Statue of Liberty, and we started this event to try to bring patients together. Interestingly, ironically, it's actually as many cancer survivors as many people that came through Ellis Island. So there's a lot of people who actually have a life beyond cancer. So we thought it was a great with Andrew and our team to try to bring patients together to celebrate their life, their survival, to their working together with other patients, caregivers, encouraging each other. And then it's really interesting to see these cross-pollinating stories around there where patients, I mean, you can actually see this, it's palpable, the energy, and patients encourage themselves.
How many come together?
Last year we had up to close to 5,000 patients.
Right. And my colleague Joanna Gagas was there, the host and the anchor of Life and Living on public television, and FiOS, produced by our production company, and she was there, and the interviews she got were extraordinary and powerful and inspiring.
I think it's very powerful to see patients engage into together celebrating their victory, supporting each other, and then moving forward.
It's a powerful event. Tell everyone again when it is.
October 8th, 2016.
Where?
Liberty State Park.
I want to thank you, Andre and Andrew. I want to thank you for joining us and getting us up to date, and make sure you come back and keep us up to date on this very important topic that whether people want to face it or not affects all of us in one way or another. Thank you so much.
Glad to be here. Thank you.
Stay with us. We'll be right back.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the Healthcare Foundation of New Jersey, Suez, Delta Dental of New Jersey, Johnson & Johnson, the Mental Health Association in New Jersey, New Jersey Sharing Network, and by the Fidelco Group. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.